Okay, the meeting is now being recorded.
Thank you. So welcome everyone to the presentation today for proposing to redefine health literacy for Healthy People 2030. Next slide, please. As mentioned in the chat box and just a moment ago, it's really important for you to submit your comments about the definition to define health literacy at hhs.gov. The deadline for your comments is August 5th, 2019, and we encourage you to share the information that we present today, as well as your thoughts with your partners that perhaps were not able to join today, so that we can get a broad input from all of the stakeholders across disciplines for today's presentation. Next slide, please.
If I may interject for a second.
Yes.
Sorry, I'm still getting feedback. This is Cindy Brock. I just want to say that we're really encouraging people to submit their comments in mid-July. We're working on a deadline for the launch of Healthy People 2030, so as soon as you can get them in, it will be wonderful. Thanks.
Thank you, Cindy. So now I'm on the slide, the Health Literacy Definition Committee. This is a group of folks that is represented by the HHS Office for the National Coordinator for Health Information Technology, by CDC where I work, and by HHS's Office of Disease Prevention and Health Promotion. And we also have members, or our leadership actually, from the HHS Health Literacy Work Group, comprised by the Office of Disease Prevention and Health Promotion and the Agency for Healthcare Research and Quality today. Next slide, please. So before we get into the details of what we've been working on, we wanted to share with you the application of health literacy. And it's quite likely, because we have so many of you on the phone, and I was lucky to see some of the organizations that are represented here today, that you will find some of your work in the scenarios that we're going to share with you. But at this point, I'd like to invite our colleague from the Office of National Coordinator for Health Information Technology to share her work. Next slide, please. And Cindy, you may need to email Lana that she can present.
She did call in on her cell phone. Lena, are you there?
Okay, she may be muted. Let me look. Jennifer, you may need to give Lana presenter rights.
She says she needs to be unmuted.
Yes, that's what it is. So I'm looking for her. There she is. Lana Moriarty, Jennifer, if you can create her as a presenter, please.
I'm trying to get to the presenters list, but it's actually telling me the full participant list isn't available for large meetings.
Okay.
So I can't see all of the presenters right now.
Okay.
Unmute the audience.
I did just, Lana, can you try to speak at this time? Okay.
I think we may be getting something now.
Okay, can anyone hear me?
Yes, Lana, thank you so much.
Wonderful.
Okay, your slide is showing.
Okay, perfect. Thank you all for allowing me to present today. My name is Lana Moriarty. I'm a senior advisor in the Office of Policy with the Office of the National Coordinator for Health IT. And I wanted to start off today by talking a little bit about how we look at health literacy and ONC and some of the opportunities. I have some data here on the left that is from our National HENT survey. We've partnered with the National Cancer Institute and the National Partnership for Women and Families for the last 3 years, and we'll continue to do this to really get at the use of health IT and where we are today. So as you can see on the left, we have a very large opportunity to leverage technology, with 84% of individuals owning a smartphone or a tablet as reported in 2018. And then the second statistic is really looking at smartphone or tablet owners that are using a health or a wellness app in 2018. So we have a little less than half, 49%. And then when we talk about individuals being offered access to their online health record, we have a little over half, 51%. So there's still a long way to go in health IT, but we focus a lot on health literacy because we realize that well-designed technology can very much help someone when they're understanding useful information about their health or otherwise, and engaging them in this learning experience without them even knowing that this is happening. It's sort of something that's happening in the background. We really feel very strongly that access leads to equity. So seamless access to data will help level the playing field and provide significant opportunities for people to take advantage of innovative applications and services that we're already seeing to help them better understand their health, derive meaningful insights on how to make improvements, and better communicate with their family members, with caregivers, and with their care team and providers. We also, though, know as health IT and even consumer e-health are rapidly growing and changing, this is such an evolving landscape, there are many challenges that we're facing. And some of those challenges I just wanted to touch on here. Obviously, I know we're getting a lot of background noise, so I apologize for that. I don't think it's on my end. So access and equity.
Please mute your lines.
Anyone, yes, please mute your lines if you're on this, because we're hearing. Okay, so access and equity I've already touched on, and just wanted to let you all know, this is something that we are taking very seriously in how we communicate to people their HIPAA protected right to access. We have focused a lot on trying to make sure we not only encourage people to get access to their health information, but making sure that they don't just have data. People don't want to manage data. They really want to understand what their records show. So I think that's where health literacy comes into play. But as you know, an important factor that's easily overlooked when talking about digital health literacy is that a significant portion of the U.S. population face basic computer literacy challenges. So computer literacy is also an area that we really look at and focus. And then leading to the overall making our health messages understandable. And some of that gets to where ONC has focused on human-centered design, or often called user-centered design, really getting at, once we create something, a product or an application or a service, are we going to that end user? Are we making sure that this is, their experience is actually useful and that they can understand this? So we do all of that in our design, and 3 of those examples that we've come out with in the past few years are our overall health IT playbook that was created for health systems and providers and care teams, as well as the patient engagement playbook, which is a chapter of that. And then on the patient consumer side, we have a guide to getting and using your health information. And we really have, tried to push that across our other teams that are working across ONC, so that we are going to the end user and making this the best experience possible to improve patient engagement and to improve understandability of the data. Getting data out of silos and into the hands of patients through trusted applications and services that the consumer designates is a really key part of what we do, and we feel that enables a lot of innovation, like iodine medical translators, which can annotate medical terms and definitions to foster a greater understanding on the part of the patient or the individual. So I will stop there and pass it over to Cindy, I believe.
Thanks very much. Jennifer, I think you can mute the lines again and advance the slide. Thanks. So I'm still getting feedback, so I'm going to try not to sound like an idiot here. I work for the Agency for Healthcare Research and Quality, and our niche in the department is to improve the delivery of healthcare. And so for health literacy, that means we try and make sure that health information, not just written information, but also verbal, is easy to understand and actionable, and that the health system itself is easy to navigate, or that patients get the help that they need to navigate the system. So we came up with these two scenarios that I hope communicate some of the breadth of health literacy, and that needs to be reflected in the definition that you're all being asked to comment on. So we first have an opportunity here. An internist tells her patient, an accountant with intermittent chest pains, to see a cardiologist. She's surprised when the patient returns the following week without having seen a cardiologist. I didn't know where to go, her patient says. And this is illustrating the importance of navigation and our assumption sometimes that people who have education or otherwise high functioning will also be able to navigate our health system, which is not always the case. The second scenario here is of success. It says a patient is discharged from the hospital with an appointment to see his outpatient doctor, a 2-week supply of medicines, and a visual display of when to take them, a confirmed understanding of his conditions and how to manage it, and an aide scheduled for 3 hours a day. And these are actually pieces of something called the re-engineered discharge, where ARC created a toolkit based on evidence about what we need to do for patients as they're leaving the hospital so that they can take care of themselves and not be readmitted shortly thereafter. So just some ideas of how health literacy plays out in the healthcare delivery world. And now Lourdes is going to provide a few more scenarios in the public health realm.
Thank you, Cindy. And Jennifer, if you can just mute the audience so that we can move swiftly, I should say.
I believe the presenters got muted, Wes. We can't hear you, Lourdes.
Okay, I'm speaking now.
There you go.
Great. Perfect. So we're in the business in public health of promoting, protecting, and improving community health and quality of life through communication, education, disease surveillance, evaluation, and research. And the slide I'm looking at now is public health scenario number 2. And I'll read that slide for those of you that were unable to get the slides or see them right now. In response to an increasing number of rabies cases in a large rural community, a health educator at the local health department has been assigned as the lead to increase awareness of rabies prevention in the community. The health educator decides to develop a website that will provide information about rabies and tips for prevention. So as the health educator, what should you consider before choosing a website as the best approach to informing the community? That's a situation that many of you have probably faced or perhaps will face in the future. And while epidemiologic data is essential to our work, definitely, we also need to understand what the preferences, behavior, skills, and culture of our intended audience are. And before deciding specifically on an intervention, we need to analyze what that target group is going to need from us in order for them to be able to make an informed decision. So we work with our partners, those that include the media, community organizations, and a variety of other stakeholders, so that we're providing the right information for the audience in the way that they need to hear it. If you can move to the next slide, please, Jennifer. So Healthy People as a whole, as an initiative, has tracked health literacy objectives since Healthy People 2010. And for those of you that have been involved, you've seen the progress of and evolution of those objectives. In the last 2 decades, in 2010 and 2020, we use the definition that you see currently on the slide and that you can also access on the link on that slide. And that definition is: health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. Very much a focus on the person or the patient in this case. Next slide, please. So a lot of research has been done in health literacy over the 2 decades of healthy people. One such study by Christine Sorensen and colleagues back in 2012 did an assessment and found in the literature 17 definitions and almost 12 conceptual models talking about the need or the gap in the definition addressing more than just the individual. So some of the things that we know from the literature and certainly from practice is that our health environment has become more complex. We're asking people to perform higher level tasks, yet our overall health literacy, and in some cases our general health literacy, has not stayed up to par to help these individuals be able to perform these complex tasks. We also know that regardless of what a person's general literacy is, that the situation matters. And in this case, I'll offer a personal example. When I had my first mammogram a few years ago, I was told that I had that they found a spot in the mammogram. And the first thing that came to my mind wasn't, let me go research this, let me ask these questions. It was about, wow, I think I might have cancer. So regardless of the academic degrees that you have or what you know from experience working in the field, the situation can in fact influence how you react and how you come to a situation. We also have recognized the important role that community organizations, specifically those that have educational components for health professionals across public health and healthcare, the role that they play in creating materials that are clear and actionable for public audiences. And more importantly, that not only that they can understand, but that they can follow through and complete a task that's necessary for them. Next slide, please. So the goal of our work group is to create a definition that aligns with the contemporary views which we've just shared on of the health literacy community. Next slide, please. When we think about health literacy and the access to services, there's a couple of things that we want for you to think about, and one of those is navigation. So not only physical navigation of a facility, but also of systems. We know that they can be very complicated, particularly when we're thinking about people who need advanced care or specialized care. Transitions to care is also very important. We know that many patients, as their health issues are more complex, the transition to care from hospital or inpatient care to community care can be fraught with a lot of danger. And oftentimes we see that they are coming back into the hospital because they may not have the support network or the ability or knowledge to know how to care for themselves. And that leads us to also the navigation amongst healthcare providers. In many cases, we're crossing systems from hospital care to community care. We're crossing services, and that really makes a toll or adds a burden to the patient or the family who may be providing care. The other element to think about is how people access services and also what they cost. For those of us that are fortunate enough to have health insurance, that is something that is a little bit less concerned. But in the cases for many of us who do have health insurance, understanding what those limitations are can sometimes be very complex, even for those of us who are reading our bills and statements. So we know that numeracy is also an issue. There have been studies to show that medical doctors and residents have trouble understanding and explaining risk ratios. And that is important because when we talk about a person's options for treatment, that's necessary information that they need to have. Next slide, please. So the definition that I'll read for you now is the starting point that the Secretary's Advisory Committee provided, and that's health literacy occurs when a society provides accurate health information and services that people can easily find, understand, and use to inform their decisions and actions. Next slide, please. So the task that we have before us is asking you, our community, our stakeholders, to consider a few things as you're thinking about this definition, the proposed definition. One, we need it to be measurable. The other one is we want stakeholders such as yourselves to think about it, to talk about it, and to see your work reflected in that definition. Our goal is to, as Cindy mentioned, get as much comment as we can before the end of July, but certainly no later than August 5th, so that we can then incorporate that definition for the launch of Healthy People 2030 at the start of next year in spring. Next slide, please. So I wanted to kind of help you all think about one way. You may have other ways, other frameworks to think about how to start proposing or how to see yourself in the work of this definition. Because I think the more we can do that, the better able we'll be to connect with the work of healthy people. So here I offer you three things to think about. And the first of those elements is structure. By structure, what I mean is, or are, the attributes of the settings in which care occurs. So what are those facilities that we're working in? What equipment do we use that we use for providing care to patients or community members? What are the human resources? So not just the number of healthcare professionals that we have, but also the qualifications that they have, including health literacy in their training, for example. And also the organizational structure. So, how much staff is allocated to particular areas? What are the reimbursements offered? So think about structure within your own context, which might be a little bit different from what I've shared here, but still very applicable to all of us across disciplines. The second element is process. So this refers to what is done in giving and receiving care. And that includes the patient's activities to either seek care and carry out what the recommendations are, as well as what the healthcare professional's activities are in making a diagnosis and recommending or implementing treatment. And then finally, the third element is outcomes. And here we're talking about the effects of care on the health status of the patient or the population in the case of public health. We're talking about improving knowledge, changing a person's behaviors, their health behaviors, and hopefully affecting their overall health, and in the process, improving their satisfaction with care. The next slide, please. And here you see 5 different images, and I added this because I think that some of us may not work in medical settings, but it's important to consider that health literacy applies across the board. We're talking about emergency responders, for example, or perhaps folks who are in the kind of work that requires application or digital information, home health as well as informatics. So all of these areas, if you think about the 3 elements and how they relate to health literacy and the needs of people with lower health literacy, are important for us to capture that as you're thinking about the definition. Next slide, please. So as
I'm
we've
sorry,
shared,
but the slides seem to have gotten stuck on the structure, processes, and outcomes slide. Now we're getting the 5 images one.
oh, okay. Thank you, Cindy. So I am now on the vetting process slide. And as we've shared, we're doing a number of activities. One is this webinar that we're having here today. Other members of the Health Literacy Work Group for HHS have had conversations with work groups from different topic areas across the Healthy People Initiative. We're asking that you comment and you share the Federal Register notice link with your partners as well to receive that information. And you are also welcome to use the information that perhaps brought you to today's webinar to share in your own listservs or newsletters with your partners. Again, urging that comments, even though the deadline's August 5th, to please provide that before the end of July. And again, reminding you to please send those comments to definehealthliteracy@hhs.gov. Move to the next slide. When you think about what you can send when you're emailing us, obviously your thoughts on the health literacy definition is very important, but also thinking about the element of measurement, which is critical for the new definition. Think about how we might be able to measure the process that you're proposing. And if you have ideas of how to link other areas that perhaps may not be represented in the current definition, when we think about health equity, limited English proficient populations, disease prevention, health promotion, those are thoughts that we would like to hear from you as well. Move to the next slide, which is our last. And at this point, I would like to open the lines for folks to comment. For those of you who are using the chat box, you can also offer your questions through there.
And if you're not speaking, please mute your line.
I see one question about the slides. Yes, we will post them on our health literacy webpage. I see. Yes, thank you, Jennifer Holtzman, for sharing the link. We will be posting the slides after today's presentation, and we will also plan to post the recording on that page. It'll just take us a few days to get the caption files. I think Joe Klein asked about why is the word can included. In our work here at CDC, we often use can to encourage people to know what is available to them to take action as an option. I don't know how other agencies use that word, but it's an opportunity for actionability. Okay, Deborah's asking for us to go back to the definition slide. Deborah, do you mean the proposed definition or the current definition? The proposed, okay. Jennifer, if you don't mind taking us back to that slide. It's the slide that, let me pull it up here. It should be slide 13, please. And for those who are not viewing the slides, I'll read that again. Health literacy occurs when a society provides accurate health information and services that people can easily find, understand, and use to inform their decisions and actions. And again, I will reinforce this is a starting point that the Secretary's Advisory Committee provided. It is not an end point, and that's really where we need your input to help us along. Okay, and Faith is asking if we can read the old definition. Jennifer, that will be slide 9. And the old definition reads, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. And someone commenting that the definitions sometimes are not in plain language. Yes, that is a comment we have received from the ones that have already come in, and one that we are working on as we receive more comments to make sure that we're aligned with what we're professing as well. But again, reinforcing the importance of your thoughts on a measurable definition, I think is really, really important for us. And at this point, if my co-presenters, Cindy or Lana, would like to say anything, I invite you to do that.
Thanks, Lourdes. There was a question about how, wait, it just disappeared. How will there be measures of an individual's level of health literacy since the definition is now environmental or society-based? So that's an excellent question, and we have received some comments reflecting or decrying the loss of that individual level. So we would welcome comments about your opinion about that. And I think that there may be consensus emerging that, you know, we need both the individual capabilities as part of the definition, as well as how the rest of us can reduce the demands and make things easier to understand and navigate. And any suggestions for language will also be greatly appreciated. In terms of the questions about anticipating increases in federal funding, I have no illusions that this definition will have any impact on federal funding. There was a question by Roger. Can you expand on the concept? This chat keeps moving when anybody puts a new comment in. And folks, you can also unmute your phone and speak to us in addition to writing. A concept of structure as it relates to how health information is communicated. So I'm not entirely clear on the structure that you're referring to. So Roger, maybe you want to speak to us.
I can try to answer the question, although I think Roger might be asking. Yeah. When I think about applying the concept of structure to communication, I'm thinking about people who are for example, in a rural setting, do they have access through phones? Do they have broadband to access information online if that's where primarily information resides? When we think about electronic health records or personal health records specifically that people might keep for themselves, how does that connect with your healthcare provider, and how do you exchange that information? So those are some examples. And then simple ones like most of us might use our websites for information sharing or social media. Do we know if our intended audiences have access to those things? And is our material, well, now if we think about the element of process, is our material written in such a way that they can easily obtain that information, even find that information?
There's a terrific conversation going on in the chat box, and I just want to remind people, please send these comments to healthliteracy.definition@hhs.gov, and then they will all be entered formally into the deliberations.
I would like to offer that if anyone has any questions about the presentation today, you can email us at healthliteracy@cdc.gov. Again, your comments on what we've talked about today should go to definehealthliteracy@hhs.gov. Jennifer, if you wouldn't mind showing that slide with that email just to make sure folks have that. But if you have questions about the slides or the recording following today's presentation, you can email us at healthliteracy@cdc.gov.
Jennifer, can you try unmuting Carolyn Catulli? She says she's not able to get through.
I can unmute the entire audience, but I'm unable to see each individual. So I'll go ahead and mute the entire audience. Everyone, if you would, mute your phones. The audience has been unmuted.
Carolyn, you can speak.
Hi, can you hear me?
Yes.
Hi, it's Carolyn Catulli from Penn Medicine. I've thought about this long and hard. I actually was at the Health Literacy Research Conference a few years ago when we actually talked about the definition because we knew this would be coming up. It seems as though we're caught with two directions to go. The one direction is the definition is the ability of the patient or the community, and maybe we need to I think that definition could cover both because I think you could discuss a community as well as a patient and their abilities. But then the second thing, I hear a lot of people will kind of use the term, well, is that material health literate? And so then they're kind of using it in a different term. Everybody knows what they mean, but at the same time it's used differently. So it's almost like maybe we need a definition for the healthcare system that provides something or material that provides that health information. And I'm just not sure we can put it into one definition because it kind of goes two different directions and there are different measurements. So I was just wondering what everybody's thought was on that.
I'm not jumping in because I'm waiting to hear if anyone else from the audience wants to respond.
I will add, I'm wondering if we've considered a definition for something being literate, like a material education.
We did develop a definition of a health literate organization, a healthcare organization. Right. I led that effort at what was then the Institute of Medicine, and there's a discussion paper where members of the roundtable on health literacy there that we developed a 10 attributes describing what a health literate organization should be doing, and has a functional definition of a health literate organization as one that makes information easy to understand and is easy to navigate, etc.
Right. And so that exists. Sorry. Yeah, so when I look at some of the other definition you put up here is like meeting the person's needs, but I'm like, well, that kind of falls into that 10 attributes of a health literate organization. So there's where I'm just a little confused. You know, do we just stick to the individual community?
I don't know if this will help or encourage your confusion, but when I talk about health literacy, I talk about there being two factors. One is the individual's capabilities, and the other is the demands that are being made on them, how difficult it is, how complex it is, whether it's something to understand or something to do. And it's the combination of those two things that results in somebody being able to understand and access health services and make informed decisions and all the rest of that.
Agree, and exactly how I present it on a regular basis also. So how do we develop does that fit into one definition of health literacy? And maybe it is the patient, part of the definition is the patient will receive information that meets their health literacy demands and be able to understand it to make informed decisions, maybe something along that line.
Deborah Whitney, I'm afraid I'm having trouble reading your comment because the typeface is much smaller. Do you want to speak up? I think I read her comment, which is, what is the definition for, which is an excellent question, because this is a definition for Healthy People 2030. So Healthy People is a health promotion program that uses measures to track the nation's progress over a decade. So this does not have to be a definition of everything that anyone ever does that's considered health literacy. But we recognize that the Healthy People definition in the past has had a strong influence in the field, and therefore are using this public comment process to try and make it as responsive to all the kinds of health literacy work that people do. But it's not going to eclipse the fact that we have dozens of definitions, and there will continue to be multiple definitions. Linda, did you want to speak?
Yeah, can you hear me?
Yes.
Great. Yeah, this is Linda Harris from the Office of Disease Prevention and Health Promotion. This is where Healthy People is coordinated. And I would just say that one of the reasons that, one of the inspirations for adding more of a systems approach to health literacy is so that there can be a way, using Health People or other kind of tools, to hold the sources of that information more accountable for the kind of information and guidance they provide for navigating the systems. So without that, it's too easy, we think, to just focus on the individual. So a lot of people have said that we should have both the individual and more of a systems approach. The systems approach does add that accountability in some fashion. We think one of the words we might focus on is that word society, which says something different from the individual, but it's very difficult to operationalize, or certainly not measure. So that's something that you all might give us some feedback on as well.
And
I think it's also
one of the things that we're hoping the definition will do is reflect areas in which HHS can make a difference, that our activities are to move health literacy forward, to measure how we've managed to do that, and therefore the definition should reflect those kinds of activities and that kind of progress.
Can you clarify for me, this is Carolyn again, my understanding is we kind of abandoned the idea of improving health literacy as far as how it's measured in individuals, because that probably is not realistic that we're going to majorly move somebody's health literacy. So the whole focus really is on how do we meet them at the health literacy level where they are. So, I'm not sure that changes the definition of health literacy from an individual community standpoint, but does make a difference. I'm just wondering if there's a different definition or a different way to measure or something different that needs to occur here while still keeping, the original intent of the definition.
You won't get me to disagree on that. I also want to respond to some questions about what does it mean to understand. So currently, we have several measures of healthy people health literacy objectives that are based on patient surveys or population surveys asking about patients' reports of their healthcare providers and whether they found their provider easy to understand. We're almost at the top of the hour. Lourdes, do you want to wrap us up?
Thank you, Cindy. I appreciate all of you for tuning in today, for asking some tough questions as well of all of us here in HHS. We will be looking forward to receiving your comments again at the Define Health Literacy at hhs.gov address, and we will also take collection of the comments from today to just remind us of the concerns, the thoughts that you in our community, our professional community, have had. So again, thank you all, and please do visit the CDC Health Literacy webpage where we will post the slides and the following recording of today's presentation. Have a good day.